Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. What should patients do if their healthcare providers aren't listening to their concerns? Today, Stephanie Desmon talks with Dr. Mary Catherine Beach about why the relationship between healthcare providers and patients is so crucial. They discuss options patients have if their questions aren't being answered and how physicians can learn to ask better questions themselves. Let's listen.
Mary Catherine Beach, thanks so much for joining me.
Well, thanks for having me.
Today, I want to talk about what to do when healthcare providers don't listen to the patients. And I know in public health, that can be an issue. And I'm curious if you could paint the landscape for us.
I think that's challenging. I think as a patient, what you're looking for is your doctor to show you that they have heard what you said, that they understand it. That might mean you're looking at them while you're talking, and hopefully the physician is looking back at you or nodding or making eye contact or reflecting back that they heard what you said, or paraphrasing you, asking you questions that are relevant to what you had just said, as opposed to changing the topic. So that's one type of listening. Are they actually taking in what you say? And if you feel like they're not taking in what you say, I think you have a couple of options, and they're not super great. One is to stop the visit right there and just say, I want to make sure that I've been totally clear, because my main concern is, and then state what your main concern, or I have a couple of questions that I really need to get an answer to. So signposting that you actually needed to stop and get some sort of positive response. Because it is possible that sometimes the clinicians, the physicians are not showing you that they're listening, but they are taking it in. So in that case, you need to be sure you can ask them to give you that confirmation. I guess the other thing is, if you feel like you keep doing that and someone's not listening to you, your health professional is not listening to you, I think if you can, should be looking for someone else.
I mean, it can be really daunting to ask questions of a doctor. And some of them don't speak in a language that we all can relate to, and things are over our heads. It seems like a pretty big burden to put on the patient.
Yeah, I mostly spend my time trying to intervene and try to improve the way health professionals communicate, so that they do proactively show patients that they're listening, so that they do explain things in a way that people can understand, not giving big, long lectures, using big words, asking people what it is that they would like to hear, what questions they have before they launch into long explanations, asking people their opinion, just getting patients more engaged, because as a patient, if you're talking more, you're going to remember more. I do think that the burden should be on the health professionals to do it well. But I guess in the absence of that, and because I think there are so many challenges for health professionals to do it well, I think it's also important to try to empower patients to get what they need when they feel like they're not.
This role of the provider-patient relationship in healthcare is really fundamental to being healthy people, isn't it?
I mean, it totally is. If you don't feel like you can trust your health provider, or that they're not listening to you, or that they're not competent, but especially if you, from an interpersonal standpoint, aren't 100% certain that they have your best interests at heart, you don't know if you can trust what they're telling you. You don't know if you want to follow the advice that they're giving you. So we've shown that if you don't feel like you have a good relationship with your doctor, you're a lot less likely to take even life-saving medications.
So talk to me a little bit about some of the provider behavior change work that you have done. And I'm especially curious, you were talking about empowering the patients.
So in some ways, those are two different things. In terms of intervening on providers and clinicians and their behavior and how they communicate, we've done a couple of interventions where we have done some teaching of clinicians. So showing them, okay, here's what a common conversation looks like. This is what happens. Like, for example, we did a whole bunch of work where we had clinicians try to talk more effectively with patients about adherence to medications. We showed clinicians, okay, this is what happens typically. If somebody says they're not taking a medication, like the clinician tends to jump in and explain why that's a bad idea and why they need to take their medications. And they don't step back and ask a lot of questions to understand what the patient's thoughts are on the medications. Do they feel like the medications are a good idea? Do they feel like it's important to take the medications? So there's like a whole field of motivational interviewing where you basically try to get from people, what do they think is important and what are they willing to do? Because the techniques of communication in motivational interviewing are so different than what we're typically taught as physicians, I think that can be really groundbreaking because physicians can see a different way to do it and to communicate. They can see it's better, and they actually are really motivated to change how they talk to people so that they can be more effective.
And I was asking also about patients.
I haven't done a lot of work with activating patients. I know that there are studies that have tried to work with patients in waiting rooms, write down your questions, write down the issues that you want to talk to your physician about. But I don't think there's been as much work there. And maybe because, as you pointed out, it feels like a lot to put on the patients.
Obviously, this relationship is key to the healthcare experience. Do certain races have more issues with their provider? If you're being treated, say, for substance abuse, is there a difference? So I'm curious.
Yeah, there definitely is a pretty substantial literature of studies looking at how communication differs by patient race and some by patient gender. Unfortunately, the studies show that doctors tend to talk a lot more relative to Black patients compared to white patients. The term that we use in communication research, it's called verbal dominance. There's more verbal dominance with Black patients compared to white patients. And that is one finding. The other thing that I think is really important that relates specifically to listening and to racial inequities is I mentioned that sometimes doctors are listening, and listening is about taking in what someone says. A very related phenomenon is taking what somebody says seriously once you've heard it. We've done some work that show that Black patients feel like their concerns are dismissed a lot more so than white patients. And we've even looked at the language that doctors use in patient medical records that might indicate that they believe or don't believe a patient, and shown that there's more indications in the records of Black patients that the physician is doubting what the patient said. I think that's a very important point and something that people haven't been paying attention to. And it kind of relates to listening in a sense of, do you believe what someone says is important? And I think that's a prerequisite for listening. You have to think that what someone's going to say is important. Then you're going to listen to it and you're going to listen seriously. And so I think, yeah, we do have racial inequities in the quality of relationships that patients have and the quality of communication.
The language is interesting, that patients will feel that even the doctors will say they doubt the patients in the records, and the patients will feel like they're being doubted. The trust component here is, I guess, crucial.
It totally is. If you feel like somebody is not taking you seriously or not listening to your concerns, you really shouldn't trust them. And trust is essential for you to get any kind of good health care.
My day job is at the Johns Hopkins Center for Communication Programs, and we do a lot of work on provider behavior change in abroad, Africa and Asia. And I know that there are a lot of barriers, for example, to family planning when there's this provider bias, that they think that the person's too young to get family planning. They think that they should be married if they want family planning. They think that they don't have enough children yet. And I'm wondering how those elements play in.
I mean, I think providers will sometimes, like any people, have opinions about, this is how to live a good life. This is what people should do. This is what people shouldn't do. And I think some people just naturally are more dogmatic and judgmental of others than other people. I think some personality research has shown that that's kind of an element of someone's personality. And so doctors are just like anybody else. And if they feel like they're judgmental of somebody's choice, then that's going to be conveyed in how they communicate with someone. I think it doesn't help that we're empowered as doctors to feel like we do have all this medical knowledge. So we get excited at the idea that we can help with a particular treatment. And if somebody doesn't want the treatment, then a lot of times the doctor will get frustrated. And sometimes it's because they actually really care. It doesn't all come from a bad place, but it doesn't make the patient feel respected when a doctor is judging their choices.
And we talked at the very beginning about, you might have to just break up with your doctor.
Yeah.
But it's so hard to find a doctor in this day and age. I mean, does it feel like you're trapped sometimes?
Probably, yeah. Especially depending on where you live and who's available to see you. Yeah, I do think sometimes you are. Our health system is broken in that way. We do not have enough primary care providers out there. And I waited 13 months to find another primary care provider after mine retired. And I am a primary care doctor. So there is you couldn't think of a person who ought to be better positioned to get in to see someone. And I had to wait forever. So yeah, I think a lot of times we feel stuck.
Mary Catherine Beach, thanks so much for your time.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.